So good afternoon, welcome to Alliance Live. I'm Irene Oldfather, Director of Strategic Partnerships and Engagement here at the Health and Social Care Alliance, and today I'm joined by John Scott QC. John is the new chair of the Scottish Mental Health Law Review. So thanks for joining us today, John, and telling us a little bit about the work. So I suppose the opening question just really is, you've been in place for a few months, what's been happening and where are we at?
Well, Irene, thank you first of all for the invitation to take part in this discussion. The review has been working for a few months now, and a lot of that for me has been just finding out what's happening, speaking to people, but more especially listening, because I was asked to chair this review not because of any experience in the area as a practitioner, because I don't really have any, but because of my background in human rights in the voluntary sector. For the best part of 30 years involved in various human rights organisations, and having carried out reviews really informed by a human rights approach, which is how we're going to do this. So listening to people, finding out what the issues are, and trying to work out the gaps between what the legislation says and what's actually happening, why there are those gaps, identifying areas of good practice and identifying things that are either not working as they were intended or not working well at all.
So you mentioned gaps there, John. What are you hearing about? Where are the areas that people feel the legislation might not be working as well as it could be? What are the kind of big ticket issues that you're going to be looking at?
Well, one of those, and it's specifically in our terms of reference, is the increased use of compulsory detention on people with mental disorders. Now, I mentioned the expression mental disorders. I'm aware that that's a loaded expression and that there are some people who are very unhappy with that. So one of the things that we will be looking at is the language, but that's what the legislation says at the moment. So that's what we've been using while explaining that we're not tied to that, and we recognise that it's a bit loaded. The increase in the use of compulsory measures is a matter of concern. It's not happened uniformly across the country. There are some places where it's happened much more than others, and we want to understand that. There's data that we're going to be able to get access to through the Mental Welfare Commission, and there's a general sense that it's not right that there's been this increase and that things are going wrong further upstream, which leads to people in times of crisis being detained as opposed to being able to remain in the community. There's a variety of factors, whether it's to do with the legislation or the interpretation of the legislation, or simply practice, and one of the big things that people have mentioned is resources, the shortage of certain of the important professionals that are required, and a lack of continuity of care, which means that risk-averse decisions are being taken that may see someone detained when that's not the right outcome for them.
So there's a lot in there. Are you going to be dealing with all of that? Are you simply looking at what needs to be changed in the law itself, or will you be looking at things like, do you have the capacity to look at things like resources, like guidance around the law, or are you sticking to one particular bit in terms of actually reviewing the legislation?
I think it's important that it's not just about reviewing the legislation. Apart from anything else, some of what the legislation says isn't what happens in practice. So it's important that it's a real, an effective, a practical review. So we're looking at the legislation, and it may be that along the way, it's likely that along the way we'll prepare a list of things which will require legislative change, but that's a few years down the line. There may be things where the principles which have been stated are fine, but the application is not, and that changes that could be made without changes in legislation. And importantly, within the terms of reference, the first draft that I saw of the terms of reference, and as the chair, I was able to agree the terms of reference before they were finalised. And I consulted on that too. Especially coming from outside, it wouldn't have been sensible to just try and finalise that on my own. But within the first draft, which I got from government, it made explicit mention of social, economic and cultural rights. That I'm taking that as a steer that resources is part of what we can look at, because social, economic and cultural rights, they are the poor relations in the human rights world. Most focus in human rights is in civil and political rights, or historically it has been. and not social, economic and cultural rights. And part of the reason for that is that social, economic and cultural rights in general terms are more expensive than civil and political rights. So the fact that social, economic and cultural rights are in there, resources is part of it, and there's a great appetite amongst many of the people that I've met for trying to look as far upstream as we can, so that instead of just looking at what are the criteria for someone being detained and what are the conditions of detention, to the extent that we're able to look at that, how do we avoid people being compulsorily detained at all? And that necessarily is going to involve looking at resources, looking at how some of the professionals are deployed, looking at the liaison between the different groups, and there's a general sense that we can do things better. That when this legislation, the Mental Health Care and Treatment Act, was introduced, brought into force in 2005, it was informed by human rights. It was after the Scotland Act and Human Rights Act had come into force, and in many ways it was regarded as world leading. But things change, and the views and interpretation of human rights changes. So it's important now that we look at it again and try and get back to a stage where the mental health law in Scotland is recognised as world leading, informed also by developments like the United Nations Convention on the Rights of Persons with Disabilities. That's also explicitly in our terms of reference. So it's not just the European Convention on Human Rights, it's the UNCRPD as well, which presents a real challenge and a test for us, because it's looking at how people with mental health problems are dealt with and saying they can't be discriminated against. So there's a challenge, there's a degree of controversy around it. So we're working, and we'll be working with you on an event so that people can maybe understand what UNCRPD involves. But we're carrying a lot of hopes and expectations with us, and I think it's very important we continue listening and that we engage with people so that they're not disappointed.
So coming to that community engagement aspect, making sure that the language is right, you've already mentioned that, and that people actually understand what rights they can claim, what their rights are. And as you've said, there are already rights there, but not everybody knows about them. So what kind of work are you going to be doing to engage with communities? How can people influence this process, John?
There's a variety of ways, and I was very keen, and it was in the Minister's remit for the review, that lived experience, those who were affected by the legislation, whether because they were touched by the Act themselves or whether as carers, were able to be to have their say and actually to be central to it. So one of the first things is that the executive team, there's a 50-50 split between lived experience and professionals. And that's not to say that there's all sorts of overlaps. Most people seem to wear more than one hat, so that those with lived experience are also professionals as well. So I recognise that. On our advisory groups, and you're obviously helping with in a number of respects, both of our advisory groups that we've set up so far, communications and engagement and compulsory measures, it's 50-50 split with lived experience. And we're also consulting at the moment. We've got a call for evidence, although to try and be user-friendly, we're not calling it a call for evidence. In some of the discussions that we've had on the communications and engagement group, some people would be put off by the use of the word evidence because it has certain connotations. People maybe think that there's a formal requirement and they might have to sign something and it's an affidavit or it's like going to court. So we want to make it as easy as possible for people and not to put them off. So we're saying, tell us what your experience is, tell us your story. And that started at the beginning of February. It runs till just towards the end of April. And it's an opportunity for people to tell us what's happened to them. Has it been good? Has it been bad? Do they feel as though they were properly informed along the way? Awareness of rights is a huge issue. And in the human rights world generally, it's always said that unless you know you've got a right, then it's pretty useless to you. So awareness of rights is something that we can do along the way. We don't need to wait for legislative change, and we can cross-fertilise. So when we go to groups, there may be people that aren't aware of things that are already in place that they can make use of. The Alliance gave us an opportunity of that because I was with you at the Alliance it was the day we announced the terms of reference, and Shabine Begum from the Advocacy Network was there, and it turned out that although it was professionals who were using the legislation, who were different pieces of legislation who were there, not everyone was aware of the extent to which independent advocates could be used. So there's something that we can do in terms of informing people, raising awareness of rights, in addition to, if we're able to identify areas of good practice within the current legislative framework, see if that can be replicated elsewhere. And people have been very generous in saying to us, we'll help in any way we can, including testing things out. And there's various things which we'll come to in our discussion here that we can test out without having to wait for the law to be changed.
So there are clearly a range of ways that people can get involved. You've got your call out for stories. If people don't want to write it all down, can they contact you? Will you be going into local communities? Are there other ways other than the written word through digital stories or something like that? Are there ways that people can get involved that may not want to sit and write it all down?
We want to do all of that. We want to be as proactive as possible. So it's not simply a question of here's the website, which is mentalhealthlawreview.scot, but it's not just that, and it's not, online's not for everyone. If people want to fill in hard copies of things and put it in, they can do that too, but equally that's not for everyone. That's not accessible as widely as we would want. So we'll be going out into communities, in particular if there are groups or networks, and there are many. If they're arranging meetings and they contact the review, we'll try and have someone there to tell them a little about the review and to listen to them. If people want to reply through their own groups and networks, then that's great too, because what we're asking people to talk about won't be, in some cases, very easy to talk about. People might not want to think about it. So if there's any support that they can be given, primarily we'll look at the local groups and networks and see if it can be done that way. But if people are looking at it saying, none of that's really for me, if they contact us through the website and our email address, we'll see what we can do to help. And digital stories, that sort of thing, is something I'm certainly open to. The last review I did was looking at the impact on communities of the miners' strike, 84 and 85. And I recognised, if we just sit in Edinburgh, we're not really going to hear all the stories. So we went to 8 former mining communities across Scotland, and we had meetings that ranged from 8 people through to about 100 people. And we heard things that we would never have heard otherwise. So we want to capture all of that. We want to get out, we go to hospitals, to go to local community groups, to go to where the people are, to hear the quieter voices. I think that was the expression that you used, which I really like. And then I was at a meeting recently and I said, well, we want to hear the quieter voices, and someone said, well, what about the loud, angry voices? And it said, well, we want to hear them too. But the risk is that sometimes the quieter voices are drowned out. And also we want to hear from the professionals too. There's a sense that some psychiatrists are now feeling that other people are being listened to rather than them. It's about everyone who knows about it, who's got experience, who can help us. Don't sit there assuming that I know it. Tell us. If you think there's something that's great or something that's terrible or something that's okay, tell us. And we want to hear, and all of this will inform us, and it will inform the second phase of the review after the interim report in May. And it will also help determine how long the whole review will take, because I know that there's been some questions about, well, how long is this going to take? There's been other reviews done, what are you doing? But this is the overarching review, and this is the first proper big review since the legislation, the 2003 Act, was introduced 15 years ago. And this is an opportunity. You know, it's not going to happen again on this scale for another 15, 20 years or maybe longer. So we want to get it right. Other pieces of legislation, other review work that's going on will feed into us. There may be some things that happen along the way, but ours is the review that will lead to legislative change. It may lead to changes in practice. It may lead to changes in codes of practice and things like that along the way. So people may have contributed to other reviews. There's recently been Andy Rome's Learning Disabilities and Autism under the Mental Health Act review. Some of that's going to roll over to us. There's some issues that are relevant there that are relevant to us, and we want to keep these other streams alive during the course of our review. And Derek Barron's doing the review and the forensic. So all of that, we're in touch with each other. Okay. We're coordinating things, and at subsequent phases of our review, this other work will come in. Adult support protection is another example, adults with incapacity. So there's work going on, not immediately done by us, but in coordination with us, and increasingly feeding in when there's drafts or recommendations or changes proposed.
I think that's quite important for people to know, because sometimes they get consultation fatigue and they say, you keep asking us the same questions, but what do you do with what we tell you? So I think it's important for people to know that is going to be connected in and joined up, and you'll do a bit of mapping of that then, I take,
absolutely.
John, you and the team.
We're doing that, we're doing mapping, and the other, absolutely, and it may be that some of the things that people want to say, they have already said to an earlier review. If they want to send us the work that they'd already prepared, that's okay too.
They'll adapt it.
They can adapt it. I've spoken to people who've maybe got more of a focus on adults with incapacity or adult support and protection, and sometimes the same individual might be touched by all three pieces of legislation. So have a look at it, see if you think that you can help us, and if you're not sure, send it in anyway. But coordinating all of that is very important. Listening to everyone who's got something to say, and then making sure that it's all properly coordinated, and that we're the ones who, on the other side of whatever length of time it takes, will be making recommendations for legislative change, informed by human rights and a human rights approach, informed by social, economic and cultural rights in particular. So it's a real opportunity which people should seize, and I understand review fatigue, but you'll have plenty of time. This is just the start of some of the conversations, and we do really want to hear from people now and at future stages.
So you mentioned in terms of the big ticket issues, compulsion and detention, that's one that you're very actively looking at. For us as an organisation, we hear a lot about power of attorney and people not having enough information early on in the process. It's that upstream early. If you can do things upstream and early, you can prevent some of the stuff that happens downstream, John. So in terms of power of attorney, are you hearing anything about that? Is that looking like it might be a change to law or to guidance?
At the moment it's not clear. There's other work going on in relation to power of attorney. I mean, as it happens, my mum and dad got me to be the power of attorney recently, so it's something that I'm aware of, not only in the terms of the review, but personally. And that can play a part in some of the bigger issues that we're looking at, like supported decision making, and also expression of rights, will and preference. So ways for people to do that. But so power of attorney, there's other work which may feed into us, and it may be that there's legislative change, or it may be that there's changes in codes or the like. And a lot of that really, I think, is about raising awareness.
Yes.
And as far as possible, to try and make sure that everyone's got a power of attorney, because you can't identify who's going to need one.
Uh-huh.
We're sitting here.
Overnight.
It could be us. I'm happy to say that my parents have identified that it's something that they might need, but doing it at an early stage when they don't. I don't need to do anything.
Yes.
But that stage could be tomorrow, 10 years, or it might never come. And advanced statements is part of what we're looking at through the mental health legislation as well.
So particularly for people with dementia who have limited capacity, thinking about this early on, perhaps after diagnosis, is really important, because we've come across cases of people who've left it too late, and at that point they can't sign their names, and that becomes a barrier to power of attorney, and then there's all kinds of legal battles that have to be gone through. So doing this upstream and early, raising that awareness, I suppose you see as part of the work of that, and we are happy to assist and support you in that.
It is, and trying to think of things that could happen to you that you hope never happen, and to better enable everyone to work out what is it that this individual actually wants, as opposed to what happens maybe some of the time, and maybe too much, where it's substituted decision making, where the person is treated like a child. And capacity is something that can fluctuate, and capacity might be in place for certain decisions, even important decisions in life, and not for others. And people also have the right to do stupid things. You and I've got the right to do stupid things, and I'm guilty of that. So the avoiding the kind of paternalistic approach where you say, well, just because someone's going to do something stupid, we should stop them doing it. But that's not the right approach either. Where it comes to whether someone might harm themselves or might harm others, then different considerations can apply. But trying to work out through the person themselves, what is it they want now? What is it they want if their circumstances change? And if they tell us that now, whether it's through powers of attorney, through a will, through advance statements, then it's much easier to say, well, we know what this person's rights, will and preference are because they told us, as opposed to, well, I think it was this because there was that occasion where he told me this, and there's uncertainty about it, there's confusion about it, or within families there can be disputes about it.
And care planning itself is a part of that process. It's just so simple for people to do with care homes, and doesn't require any legal intervention, but just sitting down thinking this is what it should look like. All I think helps when later and more difficult decisions have to be made.
Absolutely. I mean, especially when you mentioned dementia, the number of people and the number of families who are affected by that, those who are touched by it realise, but maybe too late, I really wish at an earlier point, or in the early stages of dementia. And dementia it's not a fixed state that's there. Yes. It may be that the person degenerates more, their condition degenerates slowly over time, and you've still got the opportunity to have those discussions or to record them for their grandchildren and have pieces of music, do the sort of things that you can stave it off.
Make quality of life
improve
better.
Improve quality of life.
And I know one of the groups you want to hear from are unpaid carers, because sometimes they don't even see themselves as carers. They see themselves as mothers, daughters, sons, aunties, uncles. So just encouraging them to think about contributing to the review, because I know from the work that we do, often it's from those very powerful stories that we actually learn very good lessons.
The unpaid carers in particular are a massive group, although we don't know how big they are, and they do for their loved ones, their families, and for society a job that you couldn't possibly put a financial value on, and which we wouldn't be able to afford anyway. And you're right that some of them don't think of themselves as carers because they're the loving daughter or the loving niece, or all sorts of family relationships. And it's absolutely crucial. One of the things we want to do is to remove barriers to their care for their family, for their loved ones. That's specifically part of what we're doing, as well as improving the rights and protections for the individuals who themselves have issues with their mental health. But the unpaid carers are hugely important. I regret that I didn't make specific explicit reference to carers in the terms of reference, but absolutely we want to hear from carers. And if you're not sure whether you're a carer or not, if you look at the call for evidence, we've expressed that as widely as possible. If you look after someone, however you want to put it, or if you're just a loving daughter, then that's fine in the situation. If your loved one's affected by the mental health law, we want to hear from you as well.
So John, you've started the work, and a bit of it's been information gathering, listening, looking at what's out there, making sure you're connecting into that other kind of landscape that's going on around human rights and United Nations and so on. What's the next stage, and what do you have stages for the review? I know you feel it's going to take longer than perhaps you had originally thought. How are you going to be working over the next 1-2 years?
Well, in phases. So until the end of April, I suppose the key thing that's happening is the responses to the call for evidence and the consultation, and then an analysis of those. And the analysis might take a bit of time because it's not, as in some consultations where it's almost like a multiple choice. Here we're looking for responses that will be rich in quality, and they'll take longer to analyse. I then need to report on an interim basis to the Minister in May, and that is going to be a description of where we are at that point, and maybe some preliminary findings and assessment of the responses to the call for evidence before moving into phase 2, where we try and work out what do we do with the information that we've got. It's likely, I think it's almost certain, that we're going to have other advisory groups, and we've already had some discussion about other groups that we might or will set up, and leading into a third phase, so that there's going to be various stages where there's different types of consultation, And as with Andy Rome's review, informed by the human rights approach, and making sure that everyone knows where you're going, as frequently as possible letting people know what we're thinking, so that the opportunity to come and say, well, hang on a second, here's something that you appear to have forgotten about. And then moving into the kind of the final phase of it, which would be as we approach thinking about recommendations for changes in the law or other changes, but also along the way, that having the scope to make interim recommendations if there's things, if there's areas of good practice or there's things of which there's poor awareness, we can make a recommendation saying that these are things that should be pushed now, because legislative change, as you know, it takes a long time, and that's one of the things. There are people at the moment who consider they're badly served by our current law, and if they have to wait for a change in the law, then they'll be waiting several years. But it may be, given that I don't think we're going to discover any new principles. We've got very good principles in place, and maybe just another look at them or dusting them off, and within existing legislation, better things can happen, and that's the sense that I have, that there's scope for that, so we can make interim recommendations so that people don't have to wait 5 years or whatever it is, because when we finish our work, the government starts its work, and then the Parliament after that. So inevitably you're talking about a long time, and I want to help people as early as possible, but to do that on the basis of having listened to them and not making any assumptions about anything.
So that sense checking as you go is really important and gives an opportunity to change in advance of the legislation where it's possible to do that.
Absolutely, I'm listening the whole time. I've gone to various meetings and conferences, and if I speak briefly, then I listen more. And at coffee break, having someone coming up, tapping me on the shoulder and saying, here's something you should know, and here's something that's not being said by the speakers at the conference because there are issues or there's small p politics involved. And I want to hear all of that. And where there's gaps, I'm hugely impressed by the people who operate in the field, whether in the voluntary sector or lived experience groups or the professionals. And there are some hugely impressive individuals in all of these different groups who are so generous with their experience and their time. And I've had meetings on a one-to-one basis and wider meetings with them as well. And what strikes me is that they're not just saying, and sometimes not saying at all, I want to improve my position. The majority of them, when they speak to me, say, I don't want what's happened to me to happen to anyone else. So that huge generosity is something that it humbles me. I feel that it's a privilege for me to listen to some of the things that people have to say, some of it very difficult, and I want to make sure that informs the process along the way. The other thing, just on the groups and the like, is every time I go to a meeting I hear about another group or a network or a forum. There's a lot of people operating in the field, and especially when you look at it in terms of social, economic and cultural rights, because local authorities are then relevant. It's a massive number of groups, individuals and organisations who are involved. So through the communications and engagement team, which group which you're obviously helping us on, we've compiled a list, and I don't think we've finished that yet. I mean, hopefully we've got most of them now, and it's already into the hundreds. And I don't mind if people hear about things we are doing from 3 or 4 different sources or networks that they're involved in, but because it's a Scotland-wide review as well, and different things seem to happen in different places because of the geography, we want to understand that, and we want to hear people in the different parts of the country. My colleague Graham Morgan on the executive team is fantastic, because if you follow him on Twitter, he's almost always out and about visiting different parts of Scotland. He was involved in the Highland Users Group for a while, and the brilliant thing about that is Graham is a great listener, he's a great thinker, and he's out and about speaking and listening to people, and he's doing our work as well. So I've got lots of good people, including yourself, helping us, and that's when I stand back and think this is very daunting. I look at the people involved and think we're going to be able to do it, because there's some really good, impressive people who are helping us, and those with lived experience in particular who have been so generous with what's happened to them, and the professionals involved too. We can do good things, I think.
Well, you've got a big job, so good luck to yourself and your team, and I know that the Alliance as an organisation, we look forward to working with you in the future, John. Thanks very much.
Thanks for everything, Irene.